Good morning to you, and it is a very big morning in Jacksonville, across Florida, and really across the United States of America. 277 days into this pandemic, 277 days locally of effects that we've felt since the cancellation of the Players' Championship. You'll remember, and since really our world has changed. Vaccines have made it. Vaccination Day in Jacksonville. Ken Amaro is live at UF Health when the first dose is about to be administered. Ken?
Lou, the first dose was given a second ago, and it was given to Dr. Leon Haley. He is the CEO here at UF Health. He's been encouraging staffers as well as others to participate and take the Moderna or the Pfizer vaccine. This morning, the first round came in around 9:30 this morning. The plan is to do about 10 shots today, 100 shots tomorrow, and throughout the rest of the week, about 2,000. This is something historic. He believes that this is an opportunity to curb the COVID-19 pandemic that we've been experiencing for the last several months, and now it's taking place here in Jacksonville. In fact, there was a nice round of applause after he took his shot, and after he took his shot, he gave a thumbs up saying that it's okay. Let's hear what Dr. Haley has to say.
Truthfully, to protect them and to protect everybody. I haven't seen them in a long time. We did Zoom Thanksgiving, probably going to do Zoom Christmas. So truthfully, I want to be able to spend some time with family.
And you gave your thumbs up, basically, it's okay.
Yeah, it's okay. Like, you didn't see me keel over, you know, so obviously we'll continue to watch side effects for the next couple of days.
But with Pfizer, you have to wait 15 minutes after the shot to be sure that things are
so you're
not having any effects.
You don't want to make sure you don't have an anaphylactoid reaction, right? So, you know, people can be not so much allergic to the vaccine because not enough people have gotten it, but they can be allergic sometimes to the carrier molecules that are in there, and so we want to make sure people don't have a reaction. But, you know, I don't have allergies, so I don't have allergic reactions, so I'm not expecting anything.
And you're telling staffers here at the hospital you're encouraging them to take it?
Yep. But it's
all volunteer.
It's all voluntary. It's not mandatory. We've got our own camera crew here, so we'll shoot a video actually in about a half an hour, and we'll send that out to all our staff. They're going to see me get it, so we're going to continue to encourage them to.
And how are you feeling, sir?
I feel good.
All right. Yeah, and here's the second recipient of the 10 who are taking it today. How are you, sir?
I'm fine, Ken. How are you?
I'm well. And your name is?
Dr. David Vukic.
And so, Doc, what are your thoughts on as you're about to endeavor into this?
I am so glad. I'm just overjoyed that we have this vaccine. We need it desperately. And I'm very happy to take it. And I wish everyone out there in Jacksonville and the entire country and the entire world takes this vaccine.
But what's the messaging for those who are reluctant?
Well, maybe the message is what I'm trying to accomplish. I don't want to take a disease home to my family or my colleagues. That's one of the reasons to get the vaccine. I don't personally want to get sick. I'm at a high risk because of my age and a couple extra pounds. Okay, a lot of extra pounds. And the third thing is we need to smash this virus. And the only way we're going to do it is to follow those rules and to take this vaccine. So I'm bound and determined, and I'm an emergency physician as well. So I have a bias. And that's the reason to do this. And the
she's
safety.
Preparing the needle right now.
Well, she's so good, I won't even know it.
Sir, could you describe how you feel to be one of the first people to get this vaccine?
In a single word, honored. I want people to understand that this is so safe. It is.
You have no reservations
Absolutely not.
About the speed of the development of the vaccine or some of the anti-vaccine messages that's out there?
Not at all, no. I know the science well. We've studied it in depth, and it's not only okay, it's great.
Okay, and give me your name again, Doc.
It's Dr. David Vukic.
Vukic?
Vukic, that's pretty close.
Let's spell it.
V as in Victor, U-K-I-C-H.
Okay, thank you, Doc.
Thank you so much.
And so Dr. Vukic is the second recipient, and behind me we've got those lined up again. It's only going to be 10 for today here at UF Health. Tomorrow it will be 100, and the subsequent days they're hoping to do about 2,000 inoculations. This morning about 9:30 they received about 9,000 doses. Now they were filling out a card. This is Dr. Vukic's card. A card like this that basically says it has a schedule as to when they took the shot and when they're supposed to have the second dose. So this is Dr. Vukic. Dr. Vukic, your card? Yeah. That's the situation. Here's the third recipient. He is in line to get his shot. And Lou, and that's how it's going to go this morning here at UF Health. Clearly a historic moment. I spoke with Dr. Healy earlier about why UF Health was chosen as one of 5 hospitals here in the state. And it's basically because it's a teaching academy. And number 2, because it's well prepared. It's got the ability to store the vaccine at the Arctic temperatures that are required, especially for this Pfizer vaccine. They're hoping to get the Moderna soon once the Moderna gets the speedy approval from the FDA. But right now, it's a good day here at UF Health, and it's a good day in dealing with the pandemic that has been ravaging our lives for the last almost 10, 11 months. Lou?
Ken, thank you. Yeah, and you know, I can tell just the excitement and the emotion that's happening there, there at the hospital, UF Health. All the employees, of course, you mentioned 10 individuals getting it in the first rollout today, but this is a coast-to-coast thing. Ken, I've been watching these exact same things happening in states all across our country right now as things are starting to sync up. Now, I know a lot of folks will have the question, Ken, as I come back, hundreds will be given out tomorrow, or 100 or so. But what can Floridians and folks here on the First Coast expect over the next coming months, you know, when maybe general population would have access to this?
Well, in the next couple of months, as you know, the first round is going to go to the frontline workers, healthcare providers, and then the next round is going to go to the nursing home community, which is another high-risk group. And then after that, it's going to be up to the state of Florida to distribute the vaccines to outlets like your neighborhood pharmacies and your physician's offices to dictate when it gets to the general population, if you will. And all speculation thus far has been that we're talking about maybe spring before that happens, because they're producing the vaccine as rapidly as possible. And one of the things that we often overlook is the fact that this is not just a United States need, it's a global need. And so other countries are of course, consuming what's been produced, and therefore there's a limited amount to what the United States is going to receive, whether it's Florida or the state of Georgia or any other state. So there's going to be a limit now, but the thing is, the step has started. That is what brings us hope, if you will, in the dark months that we've had in dealing with the rising numbers. As you know, Florida is now above 1 million cases, and not to mention the number of deaths, and it just seems like it keeps going up. And so as Dr. Healy and the other physicians said earlier, you know, they long to see their family members. They've been doing it by Zoom because they know the potential of this virus and don't want to be exposed or even expose a loved one to it. So this is going to bring that kind of relief that we've all been looking for.
Ken Amaro, thank you so much for that, and thank you so much for these live looks now. This is happening. We've already seen, I think, some 4 of the 10 doses that'll be given out this morning. A nurse there, we're seeing, as per the name tag that we were able to see, an RN who just took the seat. Couldn't see exactly what her name was, but also the medical professional providing the shot there who has been given it. This is an interesting phase. It is a 2-phase process, Ken. As you know, you've got to get this initial shot. But again, kind of mention to folks, you mentioned that card that the first doctor said they're going to have to come back a second time.
Hey, Lou?
Yes.
Lou?
Go right ahead, Ken.
Lou? Daniel.
Hi.
Hey, Danielle, how do you feel?
I feel good. I'm really, really happy to get the vaccine. And sorry.
Go ahead, Daniel. Keep talking.
Just happy to start getting back to normal and potentially save some people from getting infected.
And you an RN?
I am.
Yeah. Why are you crying?
I've been working with these patients for so long, and I've just seen what it can do. I'm sorry. I really need to get back to my patient.
Thank you, Danielle. Danielle, the third recipient, and very emotional because as she's been working with these patients, and she knows the other side of the consequences, the most severe consequences of COVID-19. Lou?
That gentleman seems to be talking there. He's about to get another dose. Ken, we're just going to stick with you. I kind of want to hear what obviously what Danielle just said that she's going through. I mean, almost 300 days now of battling this with her patients.
What's the first thing you're going to do after you get your second shot and supposedly immune to COVID? What do you want to do?
Probably still the same thing, wear a mask, wash hands. We'll see what happens like down the line. Hopefully the vaccine will be very successful.
Why is it so important for you to keep preaching that, to keep wearing the mask, keep doing the social distancing, even though we do have...
Well, we got to build immunity, so it's going to take some time. I also have some parents that are elderly, so I got to protect them because I still see them on a regular basis. So it's very important.
Why did you decide to be one of the first here in the...
I'll be honest. Found out this morning I was going to get it anyways on Friday, but it got accelerated to Monday. So I think it's a better late than never, I guess. But yeah, I think it's going to be a good thing for everybody.
Are you feeling excited, nervous? What are you feeling?
I'm feeling everything with all the cameras in front of me. But yeah, very excited, very honored, and hopefully it works out.
You're more nervous about the cameras than the vaccine?
Yeah, more nervous with a. My name's Ben Beto. I'm one of the pharmacists over here at UF Health Jacksonville.
We're going to watch it. Very good. Thank you, Ben.
Thank you, guys.
All right, we just heard from one of the pharmacists here at the hospital who said he was going to take the shot anyway, and today was the opportunity, and so he stepped up. I think the echoing sound that we're hearing from all those, and it's perhaps because they're in the health field, but they're all confident in this vaccine and the difference it can make in saving lives.
Ken, and I know a lot of it has just had, get a little sticker there. Did his thing. A lot of it has had to do with just time, just the wait, the unknown of when this will get back to normal, and still not known. This guarantees nothing. It's certainly a step in the right direction. For those who want this vaccine, those who need this vaccine, certainly a step in the right direction. But just any glimmer of hope right now, especially for our healthcare workers who, we're talking to doctors and nurses all the time who are just battered and beaten, who have gone through COVID themselves and survived and then gotten right back in the line of fire, Ken. Just the weight off the shoulders has got to be tremendous as we continue to watch those healthcare professionals.
They've seen it, Lou.
Yeah.
And you said it, front line, so they've seen it. They've seen, at times they've been the only ones with these individuals who were experiencing the worst case of COVID-19. They're the ones who would comfort them. They're the ones, and so they've seen the harsh reality of what this virus can do. And so their hope is not just a hope out of of nowhere. I mean, it's out of their experience and the science that they know, and they trust the science, and they're confident because of the 94-95% efficacy of the vaccines. So they're going to be first in line, not because they're going to go back into one of the units with someone who may have been diagnosed with COVID-19, but the fact that they know it brings hope, the fact that they know it reduces the spread of the virus, the fact that they know this works. Lou.
And it's an interesting gesture. Obviously, you bring in the cameras, you bring in members of media and journalists to kind of showcase this for the reason of it, the historical purpose of it. But I think there's also this goodwill element as well, Ken. You get these professionals showing the general public that they're confident, they feel safe taking it, and therefore when the time comes, in a general sense, it should be comfortable for folks out there as well.
And I think that's what Dr. Healy was saying, that he's going to be an example. He's the CEO, you know, he's the lead health care provider here, and if he's reluctant, how should the others behind him feel, you know? And so that's why he so gladly stepped up front to be first to get it done, you know. And here we have another recipient.
Me siento lo más bien.
Bien, ¿estás nervioso? ¿Estás emocionado? ¿Qué sientes?
Un poco nervioso nada más.
¿Sí? ¿Qué es lo que te preocupa? ¿Por qué querías ser tú de los primeros en ser vacunados?
Siempre he estado recibiendo vacunas desde que estoy trabajando aquí y yo no creo que hay que tenerle miedo a esto.
Okay.
So Miguel, in English, how do you feel? You're okay?
I'm feeling okay. Feeling fine.
And why you step yourself up to do it?
Well, I mean, there's nothing wrong about it.
Are you in that high-risk group, or, I mean, do you
Well,
have
yeah.
family members who've been exposed? Why?
Not that I know of. None of my family members have been exposed to it yet.
What is your message to the public who might be scared to get the vaccine?
Not to be afraid about it. You know, there's nothing to worry about it.
Here it comes, so you're going to be hit. Are you nervous?
You have to tell him?
No, I don't.
I'm hoping he doesn't feel it.
And what do you do here at
I work in the core lab.
do you know anyone personally who may have been exposed to COVID-19?
No, not that I know.
But you know the stories, you know
Yes, I do.
how horrific it can be.
Yeah, I heard about it.
Do you think this is hope?
Yes. Yes, I do.
Expound on that. What do you mean?
Well, I mean, if all the vaccines that we've been receiving during so many years have been working fine, why would I be afraid of this one? You know.
Miguel, your last name is?
Ortiz, O-R-T-I-Z, Ortiz, Miguel Ortiz.
What's the first thing you're going to do now when you get your second shot? When you're immune to COVID-19, what do you want to do?
Nothing. I'm not going to do anything.
¿Por qué piensas como hispano, sabiendo que los hispanos, los latinos, hemos sido tan afectados por el COVID-19? ¿Por qué crees que como hispano es importante tú estar enfrente de las cámaras, ser parte de este equipo de los primeros que reciben esta vacuna?
Because they're large
Porque es bueno que los hispanos empiecen a recibir la vacuna para que no tengan miedo. Es mejor protegerse que conseguir el COVID-19 y morir de ella.
¿Y entre su familia hay nerviosismo? ¿Cómo se siente la familia de recibir esa vacuna?
Bueno, que yo sepa, todo el mundo está loco por recibir la vacuna. ¿Sí? Especialmente mi esposa que quiere recibir la vacuna también.
Claro.